Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Question number first, gastrocnemius extend up to which region? Options A, hock, options B, stifle, option C, phalanx, or options D, knee. The right answer is option A, that is a hock joint. Gastrocnemius muscles actually extends up to hock joint. Okay, the gastrocnemius muscles is a complex muscles. It is a fundamentally involved in walking and postures maintaining, and it's affect the lower limbs and the movement of the hips and lumbar area. Okay, and if we see the origin of this gastrocnemius muscles, then it's originate at proximals to articular surface of lateral condyle of femur and medial condyle of femur. Okay, and the insertion of a gastrocnemius muscles is at Achilles tendons, and the artery which supply to the gastrocnemius muscles is sural arteries, and the nerves supplied to the gastrocnemius muscles are tibial nerves from the sciatic nerves. Questions number second, the portal vein in the ox drain blood to option A, duodenal, options B, hepatic, option C, pancreatic, options D, liver. The right answer is option D, that is a liver. Okay, the portal vein or hepatic portal vein is the blood vessels that actually carry blood from that gastrointestinal tract, gallbladder, pancreas, and spleen, and pour that blood to liver. Okay, this portal vein is usually formed by the confluence of the superior mesenteric splenic vein and inferior mesenteric vein and left and right gastric vein and the pancreatic vein. Questions number 3. The testicles in the fowl lie ventral to the anterior lobe of the option A, adrenal, options B, spleen, option C, liver, options D, kidney. The right answer is option D, that is kidney. The testicles in the fowl lie ventral to the anterior lobe of the kidney, that is the abdominal testes that presents in case of fowl. Okay. The male chicken has two testes, that is two gonads, which is located along the chicken back, ventral to the anterior lobes of the kidney. And the test is this test is, if we see the shape, then it is elliptical in shape and light yellow in color. Okay, and this both gonads are well developed in case of a male chicken, but if we see that female, then only that left ovary and left oviducts are mature, that the right one is suppressed in case of female chicken. Okay. Questions number 4. Average weight of the brain in the ox is about option A 240 gram, options B 480 gram, option C 560 gram, options D 720 gram. The right answer is option B, that is a 480 gram. Okay. The average weight of the brain in the case of ox is 480 gram. Questions number 5. The muscles which extend the forelimb as a whole is option A, medial digital extensor, options B, common digital extensor, option C, extensor carpi radialis, options D, lateral digital extensor. The right answer is option B, that is a common digital extensor. Okay. The muscles which extend the forelimb as a whole is the common digital extensor. There are two groups of muscles located on a forearms, that is the extensor group and a flexors group. Okay, the muscles which extend the forearms, or which extensor group of muscles of forearms, are that extensor carpi radialis, extensor carpi obliquus, medial digital extensor, common digital extensor, and lateral digital extensor. Okay, while extensor carpi radialis extend the carpus, extensor carpi obliquus assist the extensor carpi radialis to extend the carpus. Okay, similarly, lateral digital extensor extend the lateral digit, medial digital extensor extend the medial digit, while the common digital extensor extend whole forelimb as a whole. Okay, and let's see that flexor group, then muscles of flexors groups includes pronator teres, which action is inappreciable. Okay, flexor carpi radialis, which flex the carpus and extend the elbow, flexor carpi ulnaris, which flex the carpus and extend the elbow. Okay, ulnaris lateralis, which assist in flex the carpus and also extend the elbow, and superficial digital flexor and deep digital flexors that flex the forelimbs. Questions number 6. The zoes minor muscles in the ox is inserted at the dash on the shaft of the ilium. Option A, trochanter minor. Options B, zoes tubercle. Option C, both A and B. Options D, sciatic foramen. The right answer is option B, that is zoes tubercle. The zoes minor muscles in the ox is inserted at the zoes tubercles on the shaft of the ilium. Okay. This zoes minors muscles is thin muscles which is placed at the ventral lateral aspect of the bodies of the lumbar and a few thoracic vertebra, and it helps to flex the hip joint. Okay, and the origin, if we see that's origin of this zoes minors muscles, then it's originate at last thoracic intervertebral dishes and bodies of lumbar vertebra. If we see that's insertion, it's inserted at zoes tubercles, and lumbar arteries mainly supply to these muscles, and lumbar veins mainly supply to these muscles. Questions number 7. The plane which is cut parallel to the median plane is option A, sagittal plane, options B, frontal plane, option C, medial plane, options D, transverse plane. The right answer is option A, that is a sagittal plane. Okay, the plane which is cut parallel to the median plane, that is a sagittal plane. Okay, sagittal plane is a anatomical plane that divide the body into left and right side, right section. Okay, and this plane may be cut at the center of the body, or maybe that away, a little away from that, the center of the bodies, and divide the bodies into equal part or to unequal part. Okay, and the median plane is that vertical plane that passes through the middle line of the body and bisect the body into two symmetrical half, that is right and left. Okay, while a transverse plane is also an anatomical plane that divide the body into that superior and inferior section. Okay, and there's a coronal and frontal plane is that anatomical plane that divide the body into dorsals and ventral portion. Okay, questions number 8. The tentorium cerebelli is a concentric fold which occupy the transverse fissures between the dash and cerebral hemisphere. Option A, pons. Options B, cerebellum. Option C, medulla. Options D, all. The right answer is option B, that is cerebellum. Okay, the tentorium cerebelli is a concentric fold which occupy the transverse fissure between the cerebellum and cerebral hemisphere. Okay, tentorium cerebelli is the horizontal projection of the meningeal dura mater that actually cover and separate the cerebellum from the cerebral hemisphere. Okay, and it's attached posteriorly to the occipital bone along the groove for the transverse sinuses. Questions number 9. Extra bronchus in the ox is given off at the level of dash space. Option A, heart. Options B, opposite to third ribs. Option C, lungs. Options D, all. The right answer is option B, that is opposite to third rib. Okay, extra bronchus in the ox is given off at the level of opposite to third ribs space. Okay, questions number 10. The coracobrachialis muscles in the ox arises from the dash process of the scapula. Options A, choroid. Options B, mammillary. Option C, coracoid. Options D, acromion. The right answer is option C, that is coracoid. Okay, coracobrachialis muscles is a small elongated muscles which is located at the medial aspect of the humerus. Okay, and the body is divided into that two parts, is upper and the lower part, and it helps to adapt the limbs and to flex the shoulder joint. Okay, if you see that's the origin of this coracobrachialis muscles, then is it a coracoid process of the scapula, and the insertion of this coracobrachialis muscle is the area which is above the teres tuberosity and the interior surface of the distal third of the shaft of the humerus. Okay, and anterior circumflex artery supply blood to these muscles, while musculocutaneous branch of this brachial plexus supply nerve to these muscles. Okay, questions number 11. For the convenience of descriptions, the hoof of the horse is divided into three parts, termed wall, sole, and option A, frog, options B, foot, option C, tectorium, options D, corium. The right answer is option A, that is a frog. Okay, a horse hoof is composed of that wall, sole, and frog. The wall is simply that part of the hoof that is visible when a horse is standing, and it covers the front and side of the coffin bone, and the wall is mainly composed of a horny material that is produced continuously and must be worn off or trim off. Okay, and it does not contain any blood vessels and nerves, and when we lifted the foot of the horse, then we the sole and frog are visible. Okay, as well as a bar of wall and collateral groups also visible. Okay, and this wall and this bar and a frog, these all are the weight bearing structure of the foot. Normally sole does not comes in contact with the ground. Okay, questions number 12. The anterior part of the molar bone in bird is from the dashbone, and the posterior part is from the quadratojugal bone. Option A, zygomatic. Options B, jugular. Option C, maxillary. Options D, quadrate. The right answer is options D, that is quadrate. Okay, The anterior part of the molar bone in bird is from the quadrate bone, and the posterior part is from the quadratojugal bone. Questions number 13. The spleen of fowl is a reddish brown rounded body which is situated dorsally and to the right of the junction of dash and gizzard. Option A crop, options B proventriculars, option C intestine, options D liver. The right answer is option B, that is a proventriculars. Okay, the spleen of fowl is a small round reddish brown organs which is situated at the right side of the junction between the proventriculars and gizzard. Okay, and if you see that spleen of a rabbit, it is elongated and spatula in shape and dark brown in color. It extended dorsoventrally along the greater curvature of the stomach. If we see that spleen of a pig, then it is long and narrow. It also extended dorsoventrally along left part of the greater curvature of the stomach. And if we see that spleen of a dog, then it's roughly human footprint shape, variable in position except the upper end, which is placed below the proximal end of the last rib. Okay, if we see that spleen of horse, then it's roughly triangular in shape, placed at the anterior and left part of the abdomen between the fundus of the stomach and the diaphragm. If we see that spleen of ox, then it is elliptical in shape, situated obliquely downward and forward direction in the upper end and left part of the abdomen between the left face of rumen and diaphragm. Questions number 14. The colliculus seminalis is a rounded prominence situated medially on the dorsal wall about a second behind the internal dash orifice. Options A iliac, options B pelvic, option C urethral, options D abdominal. The right answer is option C, that is urethral. The colliculus seminalis is a rounded prominence structure which is situated on the ventromedial wall of the urethra, about 5 centimeter caudal to the urethral opening from the bladder. Questions number 15. The cardiac notch is most prominent in the lungs of option A horse, options B pig, option C fowl, options D ox. The right answer is option A, that is a horse. Okay, the cardiac notch is most prominent in the lungs of horse. Okay, and actually the cardiac notch is located in the left lungs, and the cardiac notch in ox is big and in the form of L. Questions number 16. The hilus of the spleen in the ox is situated at the option A ventral third of the visceral surface, options B dorsal third of the visceral surface, option C dorsal third of the parietal surface, options D ventral third of the parietal surface. The right answer is option C, that is that is B dorsal third of the visceral surface. Okay, hilus is situated at the dorsal third of the visceral surface. Hilus is the structures from where that all the blood vessels nerves enter into the that is spleen. Okay, questions number 17. The reflection of the pleura from the mediastinums upon the corresponding lungs is termed as option A costal pleura, options B pulmonary pleura, option C parietal pleura, option D mediastinal pleura. The right answer is option D, that is the mediastinal pleura. Okay, the reflection of the pleura from the mediastinums upon the corresponding lungs is termed as mediastinal pleura, while costal pleura is the pleural portions which cover the inner surface of the rib cage. Okay, this pleura is a serous membrane. That's a two-layer membrane, pleural sac. That outer there's a parietal layer, and inner there's a visceral layer. This parietal layer is actually attached to the chest wall, while the inner visceral layers cover the lungs, blood vessels, nerves, and bronchi. Okay. Questions number 18. Laterally, a large part of a mass of bones curves dorsally and backward in base of cerebellum, forming the option A posterior cerebellar peduncle, option B anterior cerebellar peduncle, option C cerebral peduncle, options D middle cerebellar peduncle. The right answer is options D, that is a middle cerebellar peduncle. Okay, laterally, a large part of a mass of bones curve dorsally and backward in base of cerebellum, forming the middle cerebellar peduncle. Okay, cerebellar peduncle actually connect the cerebellum to the brainstem. There are 6 cerebellar peduncle in total, each on 3 sides. Okay, first is that superior anterior cerebral peduncle. There's a pair of a peduncle which connect cerebellum to that midbrain. Okay, and then middle cerebellar peduncle. This a pair which connect the cerebellum to the bones. Okay, inferior and posterior peduncles is a thick ropes like structures that occupy the upper part of the posterior district of the medulla oblongata. Note that cerebrum peduncle are the two stalk that attaches the cerebrum to the brainstem. Questions number 19. The popliteal artery is the direct continuation of dash artery in ox. Option A, tibial. Options B, femoral. Option C, sapina. Options D, nutrient. The right answer is option B, that is a femoral artery. The popliteal artery is a direct continuation of femoral artery in ox. Okay. The popliteal artery is the continuation of femoral artery that passes between two head of the gastrocnemius muscles, then through popliteal regions and divide into cranial and caudal tibial arteries after giving some branches to the biceps, femoris and gastrocnemius muscles. Okay, that cranial and caudal tibial artery. The caudal tibial artery is small and it's mainly supply the popliteals and digital flexors muscles, while the cranial tibial artery is large. It passes down through the interosseous space to the anterior aspect of the tibia and tarsus, and it's continue as a dorsal pedal artery. Okay, cranial tibial artery give branches to that popliteal, semimembranous, and most of the extension muscles. Okay, the dorsal pedal artery give few branches to form tarsal reti in front of the tarsal joint, and at the little below give one perforating branch which communicate with proximal plantar arch. It continue down on the metatarsals group as dorsal metatarsals artery. Okay, and the dorsal metatarsals artery descend down below the fetlock joint as a dorsal common digital artery. Questions number 20. The glands of the clitoris in which form a pointed projection over the fossa. Option A, clitoridis. Options B, vestibular. Option C, labial. Options D, none. The right answer is option A, that is a clitoridis. The glands of the clitoris in which form a pointed projection over the fossa, clitoridis. Questions number 21st. The pancreatic duct leave the posterior part of the ventrolateral border and enter the dash, which is the part of the small intestine, about 30 centimeter further back than the bile duct. Option A, jejunum. Options B, duodenum. Option C, ileum. Options D, all. The right answer is options B, that is duodenum. Okay. The pancreatic duct arises from the posterior part of the right border and open into the duodenum about a foot behind the opening of the bile duct into the duodenum. Questions number 22. The reticular group start from the dash and end at the reticulomasal orifice. Option A, cardia. Options B, esophagus. Option C, rumen papilla. Options D, abomasal orifice. The right answer is option A, that's a cardia. Okay. The reticular group start from the cardia and at the reticulomasal orifice. Okay. Reticulum, which is also known as a pyriform sac, is the smallest of all that four compartment situated between the diaphragm and the liver in front and dorsal sac of the rumen and omasum behind side. Okay, this reticular group has a two surface, two curvature and two ends. Okay, there's a two surface, that's a parietal surface and a visceral surface. If we see that parietal surface is convex and related to diaphragms and liver, while visceral surface is related to atrium ruminis. Okay, and there's a note that horny papillae are found in reticulums. This is the most important questions which may be asked in a ICR exam. Okay, this where is the horny papillae are found? Then horny papillae are found in reticulum. Questions number 23. Highest point of skeleton is formed by option A, lateral angle of ilium, options B, medial angle of ilium, option C, external angle of ischium, or option D, internal angle of ischium. The right answer is option B, that is a medial angle of ilium. Okay, highest point of skeleton is formed by medial angle of ilium, and point of hip in animal is formed by that lateral angle of ilium. Internal angle of ischium is a narrow and it's joined with that the other internal angle of ilium and pubis and to form the cotylioid cavity. Okay, while the external angle of ischium is expanded to form the trifid ischial tuberosity. Questions number 24. The occurrence of accessory ligament in a hip joint is the characteristic features of option A, ox, options B, horse, option C, camel, options D, dog. Good. The right answer is option B, that is a horse. Okay, the accessory occurrence of accessory ligament in the hip joint is a characteristic feature of horse. Okay, normally if we see that hip joints capsules is mainly composed of three major ligament, that is iliofemoral ligament, pubofemoral ligament, and ischiofemoral ligament. Along with this ligaments, there is another accessory ligaments which is found in the hip joints of the horse. Questions number 25. The cornual diverticulum is the part of dash sinus in the ox. Option A, maxillary. Options B, palatine. Option C, sphenoidal. Options D, frontal. The right answer is options D, that's a frontal. The cornual diverticulum is the part of frontal sinus in the ox. Okay. This coronal diverticulum is the largest diverticulum, while the nuchal diverticulum is the smallest one. Okay. Questions number 26. The cribriform plate is a sieve-like partitions between the cranial and dash cavity. Option A, oral. Options B, vertebral. Option C, nasal. Options D, pharyngeal. The right answer is option C, that is a nasal. Okay. The cribriform plate, that is a lamina cribosa of ethmoid bone, is a sieve-like structure between the anterior cranial fossa and the nasal cavity. Okay. This cribriform plate is a part of ethmoid bone and support the olfactory bulb which lie in that olfactory fossa. Questions number 27. The occipital bone is situated at the part of the cranium. Option A, dorsal part. Options B, ventral part. Option C, posterior part. Option D, anterior part. The right answer is option C, that is a posterior part. The occipital bone is situated at the posterior part of the cranium. Okay. Occipital bone is a single cranial bone which form the superior as well as a posterior aspect of the skull, and it has mainly three parts, that's lateral mass, basi-occipitals, and supraoccipitals or squamous part. Okay. Questions number 28. The upper surface of arc of atlas has a posteriorly transverse concave articular surface. That is option A, atlantal bursa. Options B, articular area. Option C, lamellar part. Options D, odontoid process. The right answer is option B, that is articular area. The upper surface of arc of atlas has a posteriorly transverse concave articular surface, which is known as articular area. Okay, let's see the atlas bone. Atlas is the first cervical vertebra. It's mainly comprised of a large neural ring, and there's a two wings. Okay, the body of the atlas is in the form of thick plate, and it's from the ventral wall of the neural ring. Okay, and if we see the wings, that are bony plate which is projected on either side of the neural ring. Okay, uh, the supraspinous prosa as well as ventral spines are in the form of tubercles in case of atlas. Okay, on the cranial aspect of the dorsal surface, there are two foramina. There's intervertebral foramina from which that spinal nerves passes, and there's a alar foramina we can found. Okay, and at the, if we see that at the caudal part of the floor, there is a depressions that is known as fovea dentis. Okay, which articulate with the odontoid process of the axis. Okay, there is another question that odontoid process is present in, then the bone is axis bone. Questions number 29. Transverse spine is longest in which vertebra? Options A, cervical vertebra. Options B, thoracic vertebra. Option C, lumbar vertebra. Options D, coccygeal vertebra. The right answer is option C, that is a lumbar vertebra. Transverse spine is longest in case of lumbar vertebra, while dorsal spine is longest in case of thoracic vertebra. Questions number 30. The aggregated tendon of the gastrocnemius and superficial digital flexors, which is inserted on the tuber calcis, is from option A, tendo calcis. Options B, tendo achilles. Option C, flexor pedis perforans. Option D, none. The right answer is option B, that is tendo achilles. The aggregated tendon of the gastrocnemius and superficial digital flexors, which is inserted on the tuber calcis, is the tendo achilles. Okay. Note that a flexor pedis perforans is a muscles which is situated behind the lower arms. It's mainly composed of three unequal portions, that is humerus, ulnar, and radial part. Okay, and if we see that's origin, then from the ridge on the inner and inferior part of the humerus, that is humeral part origin. From the upper and posterior part of the ulna, that the ulnar part is origin. From the posterior surface of the radius, that's the radial part is origin. Okay, and if we see that insertion, this all three portions get united and form a one common tendon which is inserted into under the surface of os pedis. Okay, that's much for today. Thank you, class.